I'm Alexandra Limon in Washington. 10 million Americans have filed new unemployment claims in the past 2 weeks. Now Congress is debating whether the government needs to provide more aid. I'll have that story coming up.
Members of Congress want the administration to expand child care services during the coronavirus pandemic. I'm Basil John reporting in Washington why lawmakers believe this is a necessity for essential workers.
The Trump administration under even more pressure to release certain migrants from ICE detention centers. I'm Jessi Turnure in Washington, and I'll have that story coming up.
I'm Anna Warnicki in Washington. Like most of us, the 2020 presidential candidates are also working from home. Coming up, I'll tell you how campaigns are changing their strategies to now reach voters virtually.
I'm Raquel Martin in Washington. The White House says it will not reopen the marketplace to allow more Americans to sign up for health insurance. Why Democrats say that's bad news for the pandemic. I'll have that full story coming up.
I'm Morgan Wright in Washington. Lawmakers are weighing in on local companies pivoting their day-to-day operations to better meet the needs of healthcare workers on the front lines of the pandemic.
A record 6.6 million Americans filed new unemployment claims last week. That's on top of the 3.3 million who filed the week before.
Every day we see the need for further action. The coronavirus is moving swiftly, and our communities cannot wait.
In a phone call Thursday, Speaker of the House Nancy Pelosi said the money Congress already approved to provide relief is not enough, and that Democrats are working on a fourth stimulus bill.
We need more broadband, we need clean water, we need to have more community health centers.
Pelosi says the new aid package should put people back to work by rebuilding America's roads and bridges. But House Republican leader Kevin McCarthy thinks Democrats need to pump the brakes.
I don't think that's appropriate at this time. We've just passed 3 bills, the largest in the history.
McCarthy says the trillions of dollars in aid Congress already approved to expand unemployment benefits and set up grants and forgivable loans for small businesses is just starting to be used and needs time to work.
I think the focus of this House needs to be right now is how do we implement it, make sure we get it right.
But earlier this week, some Republicans and President Trump expressed support for a fourth relief package focused on infrastructure. In Washington, Alexandra Limon.
New York Senator Kirsten Gillibrand says Americans are coming together to protect healthcare workers on the front lines of the pandemic.
Everyone is giving their best to help people who need help.
Gillibrand says local manufacturers and even schools are pitching in to provide desperately needed personal protective equipment or PPE.
The head of SUNY has made 2 dormitories available for beds. She's also used the Fashion Institute to start sewing masks and gowns.
Priya Bathija says the American Hospital Association is challenging manufacturers, businesses, and individuals to produce 100 million masks for our healthcare workers.
We're seeing manufacturers in Washington State and New Jersey change over their lines so that they can start making surgical masks for hospitals. We're seeing a lot of larger manufacturers like Tommy Hilfiger, Gap, New Balance step up to the plate.
Some in Congress say the issue highlights the need for President Trump to unleash the full capacity of the Defense Production Act.
What we can do under Title I of the Defense Production Act is we can literally go and jump the line.
Rhode Island Senator Jack Reed says the act would prioritize the production of essential needs to fight this pandemic.
We have to have these. Here's the price we're going to pay, and we're going to move these to places where it's needed.
Reed says healthcare workers must stay healthy to help stop the spread of the pandemic. Reporting in Washington, I'm Morgan Wright.
Some of us can't stay home. Healthcare workers, first responders, grocery store workers, and delivery drivers, to name a few.
These Americans have families, and they have children.
Lawmakers like Pennsylvania Senator Bob Casey want the Trump administration to expand options for child care for these essential workers.
There's no way that you'll be able to do that job well if you're worried that your children are not being cared for.
22 senators have signed a letter asking the Office of Child Care to take immediate steps to expand child care options for essential workers.
This pandemic, which makes everybody more nervous and anxious, not only about their own health, but about the health of their kids. When you compound it, it raises the need.
Virginia Senator Tim Kaine says the recent coronavirus relief package included $3.5 billion for a child care development block grant.
The very workers who we rely on the most are probably the group of people who have the most to be concerned about right now. If we can reduce that concern a little bit by providing resources for childcare, then we should do that.
Senators asked the department what options would be possible, such as using closed Head Start facilities to offer temporary child care. But they say a decision needs to be made soon.
We also have to think very creatively, not just with regard to the dollars appropriated, but also the policy.
The Office of Child Care had no immediate response. The senators want details from the office by April 6th. Reporting in Washington, I'm Basil John.
This is a public health crisis. We don't want anybody who is sick fearing getting help.
Illinois Democrat Cheri Bustos says she's outraged that the Trump administration is refusing to open the enrollment period for the Affordable Care Act, leaving millions of Americans to face the pandemic without insurance.
It is just such a short-sighted mandate.
This is really a decision that affects not just the uninsured, it affects everyone.
Health insurance advocate Joshua Peck says the decision will accelerate the spread of the coronavirus.
The lack of coverage will delay detection and treatment.
He says what's worse, many of the essential workers keeping the country running don't have coverage.
There's heavy overlap between them and the people who are likely to be uninsured.
The White House says it's already taking steps to try and help, like expanding Medicaid benefits. But the president does admit that more steps need to be taken.
They don't qualify for Medicaid. Right. What do they do? Group, and it's a pretty big group. We're looking at it.
But Kansas Republican Ron Estes says Americans who didn't enroll last year already showed they didn't want Obamacare.
Large numbers have chosen to go that route. And so they figured out a plan for how they're going to address that.
Estes also says Congress made coronavirus testing free for all Americans, which will help slow the virus's spread.
There's more work to do.
For now, Bustos says Democrats will continue to call on the president to open insurance markets. In Washington, Raquel Martin.
Ohio Senator Rob Portman says U.S. tariffs on Chinese goods make it harder for companies like Gojo, the Ohio-based maker of Purell, to get the raw materials they need.
The 25% tariffs that are on those products are costing Purell about $10 million.
He hopes the administration backs off on some of those tariffs.
I hope that by the end of this week we will have a successful outcome there and we will be able to get an exclusion from those tariffs.
He's not alone.
We're concerned that access to critical medical equipment and supplies is hindered by the current tariff policy.
Jason Oxman is president of ITI, a trade group that represents the tech industry. Today, he sent a letter to the United States Trade Representative that listed 62 products impacted by tariffs.
Now, these tariffs are interfering with our ability to get access to critical medical equipment today. We need these tariffs addressed right now.
But this week, President Trump denied reports his administration might remove some tariffs for 90 days.
I didn't do anything about tariff payments. I don't know who's talking about tariff payments.
Senator Tammy Duckworth of Illinois says even if tariffs are removed, the U.S. still depends too much on China.
So we take the tariffs off on China. We're still dependent on China. We need to be able to manufacture our own goods and keep that capacity here in the U.S.
It's unclear if or when the president may announce a change in U.S. tariff policy. Reporting in Washington, I'm Trevor Shirley.
Even though presidential candidates are no longer shaking hands and kissing babies, the race for the White House hasn't stopped.
Welcome to our very first Latinos for Trump online town hall.
We're operating entirely digitally.
Trump campaign press secretary Kayleigh McEnany says the campaign is now reaching voters online.
Essentially doing virtual town halls, virtual ways to connect with our supporters.
The Trump campaign says its online campaign reached more than 1 million viewers this week.
It will be very, very frequent, multiple events per week, perhaps one a day.
And the remaining Democratic challengers, former Vice President Joe Biden and Senator Bernie Sanders, are also changing their approach.
I'm sitting in my basement. There's a television studio set up down here. And I'm being told by the people who run this thing for me and staff that millions of people, over 20, 30 million people now, have heard what I'm saying.
And it's not just presidential candidates adjusting to this new platform. Lawmakers across the country are finding new ways to reach voters.
This is wild times, but it's forcing all of us to figure out ways to connect with people.
Texas Republican Congressman Will Hurd isn't running for re-election, but he says everyone in office is trying new strategies.
I'm going to do, some Facebook Lives. I'll do some teletown halls. Continue to interact with folks on social media.
It really is, kind of new age campaigning.
McEnany says while you might not see anyone going door to door, those same volunteers are now making campaign calls from home. In Washington, I'm Anna Warnicki.
All of these facilities are like a petri dish for the virus to just explode.
Bruce Hamilton, the attorney for the ACLU of Louisiana, says the state's crowded ICE detention centers are a ticking time bomb for a coronavirus outbreak.
There's really no way for the people detained there to protect themselves.
Hamilton has been working for months to get certain asylum seekers released on parole while they pursue their cases.
We sued the government to force them to start following their own rules.
He says the pandemic makes it a matter of life and death.
Many of them are eligible for release and they should be released. That has just not been happening.
The ACLU nationwide has also been pushing to temporarily release certain nonviolent inmates from federal prisons. The Bureau of Prisons has reported 3 deaths due to the virus and many more cases in one Louisiana facility alone.
We want to see people released who can be released.
Members of Congress, like Louisiana Senator Bill Cassidy, say they understand the issue.
It is a way to not just protect the prisoners, but to protect the prison guards and to protect the people who work there.
But Cassidy says the decision should be left up to the Bureau of Prisons.
BOP's got a tough job. They've got to figure that out.
In Washington, I'm Jessi Turnure.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament. I'm 28 years old. We fear that we may not survive this pandemic, and yet we show up every day to this hospital to take care of our community. This is a man-made problem, and we need a man-made solution. We are told that they are searching for more PPE. Today, I stand with the nurses to call upon Donald Trump, upon our local and our hospital leadership to stop looking for PPE that doesn't exist and start producing it. We are past the point of last resort.
We are transmitting the disease to our family members, the patients who are negative for COVID-19, and we are spreading this disease to the community from this right hospital.
怎么说呢？因为他在那个发热门诊工作的话，因为也不知道自己有没有接触这一块，所以他们就一直隔离在那个200山庄嘛，住那边在。然后直到就是说现在，因为我们小区刚刚解封，然后今天休息的话，就是说回来看一看孩子，也是孩子2个多月没见到他。
Yeah, absolutely.
Thank you so very much.
Have a good day, guys.
The COVID-19 crisis really shut us down. I think what this crisis has shown is just how vulnerable a lot of the tipped wage workers really are. The family meal usually happens pre-shift where the whole crew gets together and they enjoy a meal together. And so what we are doing every night is we are from 6 to 8 p.m. Opening our window, and we are distributing hot meals and care kits to industry folks who come up and are in need.
Right now we're out of work because of the coronavirus. This has really affected our situation, so I'm very happy, and we have like organizations and restaurants that help us out as we're in a time of need.
Hook Hall's been doing a great job of working their magic, of getting in a lot of donations. And so what we do is we try to just give back as much as we can while we're in this little bit of turmoil. We're all in it together.
Thank you, bye-bye.
No problem, stay healthy, guys.
The idea of this optional masking that you can wear is hopefully going to empower people and make them feel more comfortable to the important jobs that they do every day. When we think about the option to wear masks in a prolonged fashion, that is an extension indifferent from our usual infection prevention and control recommendations, right? We don't like to wear PPE, personal protective equipment, outside of those direct healthcare worker-patient interactions. We are offering this because of this lack of really definitive knowledge around this, the role of asymptomatic or pre-symptomatic transmission. We also recognize that healthcare workers have a tough time staying 6 feet apart in many parts of our facilities, and so this could be potentially a mitigation for that. The most important thing we can do in the community is social distancing, the physical distancing. This is critical and needs to keep going. People may have seen the new triage tents outside of the Harborview Emergency Department, and you will be seeing outside of other emergency departments in the city going forward, is this idea of how can we spread out patients. So when we think about if we were to see a large surge of patients with suspected or known COVID-19 infection, one of the most important things we can do above and beyond masks and everything else is actually create some distance between the patients themselves so that we don't have people who have COVID-19 really close to someone who doesn't have COVID-19.
I'm worried about so many things right now. I don't really have a steady source of income right now. I am freelancing as a musician, as a teacher, and doing like production work right now.
I tested positive last Tuesday, so about 10 days ago, and then I was laid off from my job this past Tuesday, 2 days ago. So it was exactly a week apart. And I know within my letter of being laid off, it was due to the current pandemic. A lot of the restaurants we worked with started to close. A lot of the wineries we worked with started to close due to government mandation. So it all really happened within a 2 week, 3 week span. It is possible that it's temporary. They let me know that the ultimate goal is to have everyone that was laid off come back at a later date, but they're not able to give a specific date or time that could potentially happen. So I'm personally just taking it as a permanent layoff.